KNEEIT XXL treat osteoarthritis, meniscus and knee pain yourself. Introduction to the anatomy of the knee. The knee joint is a fascinating structure of the human body that has a complex anatomy to provide mobility and stability. In this in-depth introduction, we will look in detail at the various components of the knee, from the bones and joints to the ligaments, tendons and muscles that support this joint and enable movement. Bones of the knee. The knee joint is made up of 3 bones: the thigh bone, femur, the shin bone, tibia, and the kneecap, patella. The thigh bone forms the upper part of the knee joint and has 2 articular surfaces called femoral condyles. The tibia forms the lower part of the knee joint and also has 2 articular surfaces that interact with the femoral condyles. The kneecap sits at the front of the knee and serves to guide the tendon of the quadriceps muscle across the knee and distribute the load on the joint. Joints of the knee. The knee joint is a complex hinge joint consisting of various partial joints. The main joint is formed between the femoral condyles and the tibial condyles and allows flexion and extension of the knee. In addition, there is the patellofemoral joint between the kneecap and the femur, which allows the kneecap to slide and rotate during movement. Ligaments of the knee. The stability of the knee is provided by a variety of ligaments that connect the bones together and control movement. The most important ligaments include the anterior and posterior cruciate ligaments, which stabilize the knee and prevent the femur from moving forward or backward. The lateral ligaments, medial and lateral collateral ligaments, provide lateral stability and prevent excessive inward or outward movement of the knee joint. Menisci of the knee. The menisci are crescent-shaped cartilage discs in the knee that lie between the femoral condyles and the tibial condyles. They act as shock absorbers and ensure even pressure distribution in the knee joint. The menisci also help to increase the stability of the knee and reduce friction between the bones. Tendons and muscles of the knee. A variety of tendons and muscles surround the knee joint and allow movement such as flexion, extension and rotation. The quadriceps muscle at the front of the thigh is responsible for extending the knee, while flexion is provided by the flexor muscles at the back of the thigh. Hamstrings. These muscles are connected to the bones via tendons and allow forces to be transmitted during movement. In summary, the anatomy of the knee is extremely complex and consists of various structures that are closely interconnected to ensure mobility, stability and resilience. A detailed understanding of the anatomy of the knee is crucial for diagnosing and treating knee injuries and disorders, as well as for developing effective rehabilitation programs. Causes of knee problems. Osteoarthritis and meniscus problems. Knee pain is a common problem that can affect people of all ages. The causes of knee pain can be varied, but 2 of the most common are osteoarthritis and meniscus problems. In this comprehensive section, we will look at these 2 causes in detail, explaining their definitions, causes, symptoms and treatment options. Osteoarthritis in the knee. Osteoarthritis is a degenerative joint disease characterized by the degradation of articular cartilage. The knee joint is one of the joints most commonly affected by osteoarthritis because it is subjected to great stress on a daily basis. The main causes of the development of knee osteoarthritis are overload of the knee due to repeated stress or injury, genetic predisposition, excess weight, which puts additional pressure on the knee, aging process and natural wear of cartilage. Symptoms of knee osteoarthritis may include pain, stiffness, swelling, and limited mobility. Diagnosis is usually made through a clinical examination, imaging such as X-rays or MRI, and laboratories tests. Treatment of knee osteoarthritis may include both conservative and interventional approaches, including pain management with medications such as anti-inflammatory drugs or analgesics, physical therapy to improve mobility and strengthen the muscles around the knee, weight management and lifestyle changes to reduce pressure on the knee, injections of corticosteroids or hyaluronic acid into the knee joint to reduce inflammation and improve joint function, surgical interventions such as cartilage repair, cartilage transplantation or knee replacement in advanced cases. Meniscus problems. The meniscus is a crescent-shaped cartilage disc in the knee joint that acts as a shock absorber and distributes the load on the joint. Meniscus problems can be caused by sudden injuries or degenerative changes. The main causes of meniscus problems are traumatic injuries, such as a sudden twisting or twisting mechanism of the knee, degenerative changes due to age-related wear of the meniscus tissue, overloading of the knee due to repeated strain or sporting activities. Symptoms of meniscus problems may include pain, swelling, stiffness, feeling of locking in the knee, and limited mobility. Diagnosis is usually made through clinical examination, imaging such as MRI, and sometimes arthroscopy. Treatment of meniscus problems may include conservative measures such as rest, ice, compression, and elevation rice method, physical therapy, pain medication, and injections. In some cases, arthroscopic surgery may be necessary to repair or remove the damaged meniscus. Overall, osteoarthritis and meniscus problems are two common causes of knee problems that can cause a significant impact on quality of life. Early diagnosis and appropriate treatment are crucial to prevent complications and facilitate a quick recovery. It is important to regularly monitor knee health, especially in those at increased risk due to factors such as obesity, advanced age, or previous injuries. Recognizing symptoms of knee problems. Recognizing symptoms of knee problems. Knee problems can affect people of all ages and can have a variety of causes, from injury and overuse to degenerative conditions such as osteoarthritis. Early detection of knee problems is crucial to initiating appropriate treatment and preventing potential complications. In this comprehensive section, we will look in detail at the various symptoms of knee problems, explain their causes, and explain how to identify them. Knee pain. Knee pain is one of the most common symptoms of knee problems and can vary in intensity, location and character. The pain can be dull, stabbing, pulling or throbbing and can occur in various places in the knee, including the front, back, side or inside the joint. The pain can be aggravated by movement, especially when the knee is under strain, and can also occur at rest, especially after long periods of inactivity. Swelling in the knee. Swelling in the knee is another common symptom of knee problems and is often accompanied by pain. The swelling can occur due to fluid buildup in the joint, known as joint effusion. This can be caused by inflammation, injury or degenerative changes. The swelling can make the knee stiff and immobile and can lead to limited mobility. Stiffness and limited mobility. Stiffness and limited range of motion in the knee can occur when joint mobility is restricted, either due to pain, swelling, or structural changes in the joint. Affected individuals may have difficulty bending or straightening the knee and may experience a feeling of locking or pinching in the joint. Stiffness may be particularly pronounced in the morning upon waking or after long periods of rest, and may subside or persist throughout the day. Grinding noises in the knee. Grinding noises in the knee, also known as crepitus, are another possible symptom of knee problems and can occur when the cartilage surfaces in the joint wear down or become uneven. This can cause friction and grinding as the bones in the joint move. Grinding noises can be annoying or distressing to sufferers and can occur both during movement and at rest. Instability of the knee joint. Knee instability occurs when the knee feels unsteady or wobbly and there is a sensation that the joint is giving way or buckling. This may be due to structural damage in the knee, such as torn ligaments or meniscus injuries, which affect the stability of the joint. Instability can increase the risk of further injury and can affect the mobility and functionality of the affected knee. Redness and overheating of the knee joint. Redness and overheating of the knee joint can be signs of inflammation, which can be caused by injury, infection or inflammatory diseases such as arthritis. Inflammation can cause pain, swelling and restricted movement in the knee and can also lead to an increased temperature in the affected area. Redness and overheating of the knee joint can be noticed visually and should be checked by a doctor. Timely detection and treatment of knee problems is crucial to promote a quick recovery and avoid potential complications. If you notice one or more of the symptoms listed above, you should see a doctor or orthopedic surgeon for a thorough examination and diagnosis, as well as to discuss appropriate treatment options. The sooner knee problems are detected and treated, the better the prospects for a successful recovery and restoration of knee health. Part 2. Self-treatment of osteoarthritis in the knee. Osteoarthritis of the knee can cause a significant reduction in quality of life as it can lead to pain, stiffness and limited movement. Fortunately, there are a variety of self-care options that can help reduce symptoms and improve function of the knee. In this section, we will take a close look at various self-care techniques for osteoarthritis of the knee, including lifestyle changes, physical therapy, alternative medicine and exercise, nutrition and dietary supplements. A healthy diet can help reduce inflammation in the body and support cartilage health. Foods rich in omega-3 fatty acids, antioxidants, and anti-inflammatory compounds may be particularly beneficial. These include fish, nuts, seeds, berries, green leafy vegetables, and spices such as turmeric and ginger. In addition, certain supplements such as glucosamine, chondroitin, and omega-3 supplements can help support cartilage health and relieve the symptoms of knee osteoarthritis. Physical therapy at home. Physical therapy exercises can help improve knee mobility, strengthen muscles, and reduce pain. These include exercises to stretch and strengthen the muscles around the knee, balance and stability exercises, and aerobic exercises to improve overall fitness. A physical therapist can develop customized exercise programs tailored to the individual's needs and abilities, which can then be performed at home. Alternative medical approaches. In addition to conventional treatment methods, alternative therapies can also be used to relieve knee osteoarthritis. These include techniques such as acupuncture, massage, chiropractic, hydrotherapy and taping. These approaches aim to reduce pain, improve circulation, promote muscle relaxation and support joint function. It is important to work with a qualified professional to identify and utilize the safest and most effective treatment options. Exercises to relieve osteoarthritis pain. Regular exercise is crucial for maintaining joint health and can help relieve the symptoms of knee osteoarthritis. Recommended exercises include low-impact activities such as swimming, cycling, walking and yoga. These activities promote joint mobility, strengthen muscles and improve overall fitness without placing undue stress on the knee. It is important to choose exercises that suit individual abilities and limitations and to make adjustments as needed. Self-treatment of knee osteoarthritis requires commitment, patience and a holistic approach. A combination of healthy diet, physical therapy, alternative therapies and appropriate exercise can help alleviate symptoms and improve quality of life. It is important to consult with a doctor or orthopedic specialist before starting any new treatment approach to ensure that it is suitable for individual needs and that there are no contraindications. What is osteoarthritis and how does it arise? Osteoarthritis is a degenerative joint disease characterized by the breakdown of cartilage tissue and structural changes in the joint. It often affects the large joints such as the knee, hip, spine and hands. Osteoarthritis can lead to pain, stiffness, swelling and limited mobility and can significantly reduce the quality of life. The exact causes of osteoarthritis are not yet fully understood, but a combination of genetic, biomechanical and environmental factors are thought to play a role. Risk factors for developing osteoarthritis include age. The risk of osteoarthritis increases with age because cartilage undergoes natural wear and tear over time and its ability to regenerate decreases. Obesity. Being overweight or obese increases the strain on the joints and can break down cartilage more quickly, increasing the risk of developing osteoarthritis, especially in weight-bearing joints such as the knees and hips. Injury or trauma. Previous injury or trauma can cause structural damage to the joint and increase the risk of developing osteoarthritis. This can be caused by sports injuries, accidents, or traumatic events. Genetic predisposition. A genetic predisposition may increase the risk of developing osteoarthritis, as certain genes have been associated with an increased risk of cartilage damage and joint degeneration. Gender. Women may be at higher risk for developing osteoarthritis than men, particularly after menopause, which may be due to hormonal and biomechanical differences. Overuse or repetitive strain. Repeated strain or overload on the joints due to occupational or sporting activities can lead to wear and tear of the cartilage and increase the risk of developing osteoarthritis. The process by which osteoarthritis develops involves a gradual degeneration of the articular cartilage, resulting in structural changes in the joint. This can lead to bone growths, osteophytes, inflammation of the synovial membrane, synovitis, compaction of the bone beneath the cartilage, subchondral sclerosis, and other structural changes. Ultimately, the progressive degradation of cartilage leads to a loss of the joint surface, increasing friction between the bones and causing pain, stiffness, and limited mobility. It is important to note that osteoarthritis is a complex condition and various factors can contribute to its development. Early diagnosis and appropriate treatment are crucial to slow the progression of the disease, reduce pain and improve quality of life. This may include a combination of lifestyle changes, medications, physical therapy, alternative therapies and, in some cases, surgery. Self-treatment techniques for osteoarthritis pain. Self-treatment for osteoarthritis pain can help reduce pain, improve mobility, and increase quality of life. There are a variety of techniques and strategies that people with osteoarthritis can use at home. Here are some self-treatment techniques for osteoarthritis pain. Heat and cold therapy. Applying heat can help loosen stiff muscles and joints and increase circulation, which can reduce pain. A warm shower, warm bath, hot water bottle or heating pad can all help relieve osteoarthritis pain. Cold therapy can also be helpful, especially for acute inflammation and swelling. An ice pack or cold pack can be applied to the affected knee to reduce inflammation and relieve pain. Low-impact activities. People with osteoarthritis should choose low-impact activities that minimize stress on the knee but still promote mobility and strength. These include activities such as swimming, cycling, yoga, tai chi, and gentle stretching exercises. These activities can help strengthen the muscles around the knee, improve joint mobility, and reduce pain. Weight management. Being overweight can put more strain on your joints and increase your risk of osteoarthritis and osteoarthritis pain. By eating a healthy diet and getting regular physical activity, people with osteoarthritis can control their weight and reduce strain on their joints. Eating a balanced diet with plenty of fruits, vegetables, whole grains and lean protein can help maintain a healthy weight. Physical therapy exercises. Physical therapy exercises can help improve knee mobility, strengthen muscles, and reduce pain. A physical therapist can develop customized exercise programs based on the individual's needs and abilities. These exercises can be done at home and should be practiced regularly for best results. Relaxation techniques. Stress can lead to muscle tension and pain in the body, including osteoarthritis pain. Relaxation techniques such as meditation, progressive muscle relaxation, deep breathing and yoga can help reduce stress, relax muscles and reduce pain. Joint protection techniques. People with osteoarthritis may benefit from certain joint protection techniques that help reduce stress on the knee and take pressure off the joints. These include wearing supportive shoes, using walking aids such as a cane or walker, and avoiding excessive standing, walking, or lifting heavy objects. It is important for people with osteoarthritis to try individual self-care techniques and find out which ones work best for them. It may also be helpful to work with a doctor or physical therapist to develop an individualized treatment plan tailored to specific needs and goals. Nutrition and dietary supplements. A healthy diet plays an important role in managing osteoarthritis pain and promoting joint health. Certain foods and supplements may have anti-inflammatory properties that can help reduce inflammation in the body and reduce the symptoms of osteoarthritis. Here are some diet tips and supplements that people with osteoarthritis may consider. Omega-3 fatty acids. Foods rich in omega-3 fatty acids, such as fatty fish, salmon, mackerel, sardines, flax seeds, chia seeds, and walnuts, may have anti-inflammatory properties and help reduce inflammation in the body. Omega-3 fatty acids may also support joint health and reduce the symptoms of osteoarthritis. Antioxidants. Antioxidants are compounds that can neutralize free radicals in the body and fight inflammation. Foods rich in antioxidants, such as berries, dark green leafy vegetables, red cabbage, red peppers, and tomatoes, can help reduce inflammation and support joint health. Turmeric. Turmeric is a spice plant that contains curcumin, a compound with powerful anti-inflammatory properties. Taking turmeric regularly or adding it to meals can help reduce inflammation and relieve the symptoms of osteoarthritis. Ginger. Ginger is another spice that may have anti-inflammatory properties and may help reduce inflammation in the body. Ginger can be used as a spice in meals or consumed as a tea to support joint health and relieve the symptoms of osteoarthritis. Glucosamine and chondroitin. Glucosamine and chondroitin are supplements that can be taken to support joint health. They may help support the production of cartilage tissue, reduce inflammation, and relieve the symptoms of osteoarthritis. There is some evidence that glucosamine and chondroitin may reduce the symptoms of osteoarthritis, but more research is needed to confirm their effectiveness. Vitamin D. Vitamin D is important for bone health and may help support joint health. Getting enough vitamin D from sun exposure and supplements may help reduce the symptoms of osteoarthritis and improve bone health. It is important to note that a healthy diet and taking supplements alone may not be enough to relieve osteoarthritis pain or improve joint health. A holistic approach that also includes lifestyle changes, exercise, physical therapy and medical treatments when appropriate is often most effective in managing osteoarthritis. It is also advisable to consult with a doctor or nutritionist before starting any new diet or supplement routine, especially if you are already taking medications or have existing health conditions. Physical therapy at home. Physical therapy at home can be an effective way to relieve the symptoms of osteoarthritis, improve mobility, and maintain function of the affected joint. Here are some physical therapy exercises that can be done at home. Stretching exercises. Stretching exercises can help improve mobility of the affected joint and loosen the surrounding muscles. Some simple stretching exercises for the knee with osteoarthritis include quadriceps stretch, standing upright. Grab your ankle with one hand and pull your foot toward your buttocks while pushing your knee area slightly forward. Hold the stretch for about 30 seconds and repeat on the other side. Calf stretch. Lean against a wall with your legs straight and place one foot forward while reaching the other backward. Keep the heel of the back foot on the floor and bend the front knee until you feel a stretch in the calf muscles. Hold the stretch for about 30 seconds and then switch sides. Iliotibial band stretch. Standing tall. Cross one leg behind the other and tilt your torso to the side while pushing your hips outward. Hold the stretch for about 30 seconds and repeat on the other side. Strengthening exercises. Strengthening exercises can help strengthen the muscles around the affected joint and improve stability. Some simple strengthening exercises for the knee in osteoarthritis include leg raises. Lie on your back. Bend one knee and keep the other leg straight. Slowly lift the straight leg off the floor and then lower it back down. Repeat 10-15 times on each leg. Wall squats. Lean your back against a wall. Bend your knees and slowly lower yourself as if you were going to sit down. Hold the position for a few seconds and then slowly push yourself back up. Repeat 10-15 times. Step-ups. Stand in front of a low chair or stair step and step onto the step with one foot. Then push yourself onto the step with your foot and bring the other foot up. Slowly lower yourself and repeat 10-15 times on each leg. Balance exercises. Balance exercises can help improve the stability of the affected joint and reduce the risk of falls. Some simple balance exercises for the knee in osteoarthritis include one-legged stand. Stand on one leg while keeping the other leg slightly off the ground. Try to maintain balance and hold the position for 30 seconds. Repeat on the other leg. Seated knee ball rolls. Sit in a chair and place a ball or pillow between your knees. Squeeze your knees together and hold for a few seconds before releasing. Repeat 10-15 times. It is important to perform these exercises slowly and in a controlled manner and to listen to your body. If you feel pain during exercise, stop the exercise and consult a physical therapist or doctor. With regular exercise and patience, you can improve the function of your knee and relieve the symptoms of osteoarthritis. Alternative medical approaches. Alternative medicine approaches can be a complementary or alternative treatment option for people with osteoarthritis. Although their effectiveness is not scientifically proven in all cases, some people report positive results and relief from their symptoms using these methods. Here are some alternative medicine approaches that can be used for osteoarthritis. Acupuncture. Acupuncture is a traditional Chinese treatment method that involves placing thin needles at specific points on the body to regulate energy flow and stimulate the body's own healing abilities. Some studies suggest that acupuncture may help relieve osteoarthritis pain by reducing inflammation and improving blood flow to the affected area. Massage. Massage therapy can help relieve muscle tension, improve circulation, and reduce inflammation in the body. By massaging the affected joint and surrounding muscles, pain can be relieved and mobility improved. Chiropractic. Chiropractic is a treatment method that focuses on manipulating the spine and other joints to improve the body's alignment and reduce pain. A chiropractic approach can help improve the mobility of the affected joint and optimize function. Hydrotherapy. Hydrotherapy, also known as water therapy, uses the healing properties of water to relieve pain and improve mobility. Exercises in water, such as swimming, aqua jogging or aqua aerobics, can be gentle on the joints and help strengthen muscles and improve joint function. Taping. Kinesiological taping is a technique that involves applying elastic bands to the skin to provide support and stability and to promote circulation. Applying tape around the affected joint can help relieve pain, reduce inflammation and improve mobility. Aromatherapy. Aromatherapy uses essential oils to relieve physical discomfort and improve well-being. Some essential oils, such as lavender, rosemary and eucalyptus, have anti-inflammatory and analgesic properties and may be helpful in relieving osteoarthritis pain when applied topically or used in a diffuser. It is important to note that not all alternative medicine approaches are suitable for everyone, and their effectiveness may vary from person to person. Before trying any alternative medicine treatment, it is advisable to seek advice from a qualified professional and ensure that it is safe and suitable for your individual needs. It may also be advisable to combine traditional treatment methods with alternative approaches to achieve the best possible results. Which vitamins can help with arthrosis pain? Various vitamins can help reduce inflammation, support joint health, and relieve the symptoms of osteoarthritis. Here are some vitamins that may help with osteoarthritis pain. Vitamin D. Vitamin D plays an important role in maintaining bone health and can help reduce inflammation in the body. Vitamin D deficiency has been linked to an increased risk of osteoarthritis, so it's important to make sure you get adequate amounts of vitamin D. Sun exposure is a major source of vitamin D, but it can also be taken through supplements. Vitamin C. Vitamin C is a powerful antioxidant that can fight inflammation in the body. It can also help support collagen production, which is important for cartilage and joint health. Foods rich in vitamin C include citrus fruits, bell peppers, strawberries, kiwi, and broccoli. Vitamin E. Vitamin E is another powerful antioxidant that can reduce inflammation. It may also help support joint health by preventing oxidative damage to cartilage tissue. Foods rich in vitamin E include nuts, seeds, green leafy vegetables, and vegetable oils such as olive oil and sunflower oil. Vitamin K. Vitamin K plays an important role in bone health and may help prevent the development of osteoarthritis. Foods rich in vitamin K include green leafy vegetables such as spinach, kale and broccoli, as well as fermented foods such as sauerkraut and kimchi. Vitamin B complex. Vitamin B complex, particularly vitamin B3, niacin, and vitamin B6, pyridoxine, may help reduce inflammation in the body and support joint health. Foods rich in vitamin B include meat, fish, poultry, whole grains, legumes, and green leafy vegetables. It's important to note that taking vitamin supplements alone may not be enough to relieve osteoarthritis pain or improve joint health. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean protein is crucial for joint and cartilage health. It may also be helpful to work with a doctor or nutritionist to make sure you're getting adequate amounts of all key nutrients and your diet is tailored to your individual needs and goals. Range of motion exercises to relieve osteoarthritis pain. Range of motion exercises can play an important role in relieving osteoarthritis pain by improving mobility, strengthening muscles and supporting joints. However, it is important to choose exercises that do not place undue stress on the joints and do not worsen symptoms. Here are some low-impact range of motion exercises that may be helpful for osteoarthritis pain. Swimming. Swimming is an excellent low-impact exercise that strengthens muscles, improves endurance, and relieves stress on joints. Swimming in warm water can relax muscles and reduce pain. Breaststroke, backstroke, and aqua aerobics are good options for people with osteoarthritis. Cycling. Cycling is another low-impact activity that strengthens muscles and doesn't place undue stress on joints. Riding a stationary bike or cycling outdoors on flat terrain can help improve mobility and reduce the symptoms of osteoarthritis. Walking. Walking is a simple and effective way to mobilize joints and strengthen muscles. It is important to walk on soft surfaces and wear appropriate shoes to minimize stress on the joints. Walking in nature can also help reduce stress and increase well-being. Yoga. Yoga can help improve mobility, strengthen muscles and promote relaxation. Many yoga exercises are gentle on the joints and can be adapted to individual needs and abilities. Gentle yoga styles such as Hatha yoga or yin yoga are particularly suitable for people with osteoarthritis. Tai Chi. Tai Chi is a traditional Chinese movement art that combines gentle, flowing movements and breathing techniques to mobilize the joints and strengthen the muscles. Tai Chi can help improve balance, promote coordination, and relieve the symptoms of osteoarthritis. Pilates. Pilates is an exercise method that aims to improve posture, strengthen muscles and increase flexibility. Many Pilates exercises are gentle on the joints and can help improve joint stability and reduce the symptoms of osteoarthritis. It is important that people with osteoarthritis develop individual exercise programs tailored to their specific needs and abilities. It is advisable to consult a doctor or physiotherapist before starting a new exercise program to ensure that the exercises chosen are safe and suitable for individual needs. Regular exercise can reduce the symptoms of osteoarthritis, improve joint function and increase quality of life. Which salts can help with osteoarthritis and knee pain? Schussler salts are homeopathic preparations based on the assumption that diseases can be caused by a lack of certain minerals in the body. There are some Schussler salts that have been traditionally used to relieve osteoarthritis and knee pain. Here are some of them. Schussler salt No. 1. Calcium fluoratum. Calcium fluoride. This Schussler salt is often used to strengthen bones, cartilage and ligaments. It can help improve the elasticity of connective tissue and support cartilage regeneration. People with osteoarthritis, especially in the knee, can benefit from taking calcium fluoratum. Schussler salt No. 2. Calcium phosphoricum. Calcium phosphate. This Schussler salt is sometimes used for joint problems because it can support bone regeneration and promote bone mineralization. It can also help reduce inflammation and relieve pain. Schussler salt No. 8. Natrium chloratum. Sodium chloride. Natrium chloratum is often used for joint problems as it can help balance fluid levels in the body and reduce inflammation. It can also help with knee pain caused by swelling and fluid buildup in the joint. Schussler salt No. 11. Silicia. Silica. Silicia is sometimes used to strengthen connective tissue and promote the regeneration of cartilage and bone. It can also help reduce inflammation and improve joint mobility. It is important to note that the effectiveness of Schussler salts for osteoarthritis and knee pain has not been scientifically proven, and their use is based on personal experience and traditional applications. Before taking Schussler salts or any other homeopathic preparations, it is advisable to seek advice from a qualified homeopath or doctor to ensure that they are suitable for your individual needs and do not interact with any other medications you may be taking. Part 3. Self-treatment of meniscus problems. The third part of the book, Self-treatment of meniscus problems, presents various approaches to dealing with meniscus problems. This part can cover various aspects, from explaining the anatomy and function of the meniscus to self-treatment techniques and exercises to strengthen the surrounding muscles. Here is a possible outline for this part. Introduction to the meniscus. An explanation of the anatomy and function of the meniscus in the knee joint, as well as a description of its role in joint stabilization and shock absorption. Causes of meniscus problems. A discussion of the most common causes of meniscus injuries and problems, including sudden injuries from sports or accidents, as well as degenerative changes over time. Symptoms of meniscus problems. An overview of the most common symptoms of meniscus injuries and problems, including pain, swelling, limited mobility, and possible joint locking. Diagnosis of meniscus problems. A description of the various diagnostic procedures used to identify meniscus injuries and problems, including clinical examination, imaging studies such as MRI, and arthroscopy. Self-treatment techniques for meniscus problems. An introduction to various methods and techniques that people with meniscus problems can use at home to help relieve their symptoms and aid their recovery. These could include rise, rest, ice, compression, elevation for acute injuries, joint-friendly exercises and exercise recommendations. Physical therapy exercises to strengthen the surrounding muscles and improve joint stability. Application of heat and cold therapy to relieve pain and inflammation. Preventive measures and long-term self-care. Tips and recommendations to prevent meniscus injuries and promote long-term joint health, including a balanced diet, appropriate shoe selection, appropriate exercise and movement techniques. and avoiding excessive stress on the knee joint. Case studies and testimonials. Case studies and testimonials from people who have successfully treated meniscus problems themselves may also be added to illustrate and inspire readers. This part of the book provides practical advice and guidance for people with meniscus problems to help relieve their symptoms, improve their joint function and enhance their quality of life. It is important that this advice is implemented in consultation with a doctor or physiotherapist to ensure it is suitable for the individual needs and circumstances of the reader. Understanding meniscus injuries. Meniscus injuries can be very painful and severely limit the mobility of the knee joint. It is important to understand the causes, symptoms and treatment options for meniscus injuries in order to respond appropriately. Here is an explanation. Causes of meniscus injuries. Traumatic injuries. Sudden twisting or impact can cause tears or avulsions in the meniscus. This can occur during sports such as football, basketball or skiing. Degenerative changes. As we age, the meniscus can become weaker and lose elasticity, increasing the risk of injury. These degenerative changes can be caused by repetitive stress or osteoarthritis of the knee joint. Symptoms of meniscus injuries. Pain. Pain in the affected knee, especially during movement or exertion. Swelling. Swelling of the knee joint may occur, often accompanied by tenderness. Limited mobility. Difficulty in extending or bending the knee, possibly accompanied by a feeling of locking in the joint. Cracking or crunching. A cracking or crunching sound in the knee joint during movement may indicate a meniscus injury. Instability. Feeling of instability or uncertainty in the knee joint, especially when walking or standing. Diagnosis of meniscus injuries. Clinical examination. A doctor may examine the affected knee joint to look for swelling, tenderness, and limited range of motion. Imaging. Imaging techniques such as X-rays, MRI or ultrasound may be used to diagnose meniscus injuries to determine the exact location and extent of the injury. Treatment of meniscus injuries. Conservative treatment. For small tears in the meniscus, conservative treatment, including rest, ice, compression, physical therapy, and anti-inflammatory medications, may be sufficient to relieve symptoms and promote recovery. Arthroscopic surgery. For more severe meniscus injuries, arthroscopic surgery may be needed to repair or remove the meniscus. During the procedure, the damaged meniscus may be sutured, stitched, or partially removed. Prevention of meniscus injuries. Strengthening the muscles. Strengthening the surrounding muscles, especially the thigh muscles, can help stabilize the knee joint and prevent injuries. Warm-up and stretching. Before exercising or doing physical activity, warm-up and stretching exercises should be performed to warm up the muscles and improve the mobility of the knee joint. Avoid excessive strain. Avoid placing excessive strain on the knee joint, especially repeated twisting or impact, which may cause injury. Early diagnosis and treatment of meniscus injuries is important to prevent long-term complications and promote recovery. If you have symptoms of a meniscus injury, see a doctor for appropriate diagnosis and treatment. Self-treatment techniques for meniscus pain. Self-treatment of meniscus pain can be an effective way to relieve symptoms and promote recovery. Here are some self-care techniques that may help with meniscus pain. Rest and protection. In the case of acute meniscus pain, it is important to give the affected knee joint sufficient rest and temporarily refrain from strenuous activities. Avoid excessive strain on the knee or twisting it to prevent further injury. Ice treatment. Applying ice can help reduce pain and inflammation in the affected knee joint. To do this, place an ice pack or frozen gel pack wrapped in a towel on the knee and leave it there for about 15-20 minutes. Repeat this several times a day, especially after strenuous activities. Compression. Using a compression bandage around the knee joint can help reduce swelling and improve the stability of the joint. Be careful not to tighten the bandage too much to avoid restricting circulation. Elevation. Elevate the affected leg to promote circulation and reduce swelling. Elevate the leg and support it with pillows or an elevated footrest, especially when sitting or lying down. Physical therapy exercises. Certain exercises to strengthen the surrounding muscles and improve mobility can help relieve the symptoms of meniscus pain. These include gentle hamstring stretches, leg raises, isometric exercises, and balance exercises. Heat treatment. Applying heat can help relax muscles, promote circulation and relieve pain in the knee joint. Use a hot water bottle, heated pillow or warm towel and apply it to the affected knee joint. Be careful not to apply the heat for too long to avoid skin irritation. Weight management. Being overweight can increase the load on the knee joint and worsen the symptoms of meniscus pain. A healthy diet and regular exercise for weight loss can help reduce pressure on the knee joint and relieve symptoms. It is important that you perform these self-treatment techniques in consultation with a doctor or physical therapist to ensure that they are appropriate for your individual situation and will not cause further harm. If symptoms persist or become severe, seek immediate medical attention for appropriate diagnosis and treatment. Rest and protection. Resting and protecting the affected knee is crucial for treating meniscus pain. Here are some recommendations for rest and protection. Avoid weight-bearing activities. Reduce any activities that could put strain on the knee or cause pain. This includes things like running, jumping, climbing stairs, standing or sitting for long periods of time. Use assistive devices. If you need to move, consider using assistive devices such as crutches to take the weight off the affected knee and reduce pressure on it. Avoid awkward movements. Be careful not to twist or hyperextend your knee as this may worsen pain and cause further injury. Ergonomic adjustments. Adjust your environment to reduce strain on the knee. For example, use a height-adjustable chair to keep the knee in a comfortable position or place a pillow under the knee to relieve pressure when sitting or lying down. Take breaks. Take regular breaks to rest and relieve pressure on the knee, especially after prolonged periods of activity. Sleep in a comfortable position. When you sleep, lie down in a position that supports the affected knee and does not place additional strain on it. If necessary, use a pillow or orthopedic mattress to increase comfort. Use supportive braces or splints. You may find it helpful to wear a supportive brace or splint to stabilize and relieve pressure on the knee during the healing process. Consult a doctor. If the pain is severe or does not improve, see a doctor. A doctor can make an accurate diagnosis and provide further recommendations for treatment. Resting and protecting the affected knee is crucial for healing meniscus pain. It is important to be patient and give the body the time it needs to recover. Be sure to consistently implement rest and protection measures to prevent further injury and promote recovery. Physical therapy exercises. Physical therapy exercises can play an important role in treating meniscus pain by helping to strengthen the surrounding muscles, improve knee mobility, and increase the stability of the joint. Here are some physical therapy exercises that can help with meniscus pain. Quadriceps strengthening exercises. Leg raises. Lie on your back and bend one knee while keeping the other straight. Slowly raise the straight leg until it is level with the other knee and then lower it back down. Repeat 10-15 times per leg. Quadriceps stretch. Stand upright and grasp the ankle of your foot with one hand while pulling the knee back until you feel a stretch in the front thigh muscles. Hold the stretch for 20-30 seconds and repeat on both sides. Hamstrings strengthening exercises. Hamstring curls. Lie on your stomach and bend one knee by pulling the heel towards the buttocks. Hold this position for a few seconds and then return to the starting position. Repeat 10-15 times per leg. Hamstrings stretch. Sit on the floor and extend one leg forward while keeping the other bent. With your back straight, slowly bend forward over the extended leg until you feel a stretch in the hamstrings. Hold the stretch for 20-30 seconds and repeat on both sides. Glute strengthening exercises. Pelvic lift. Lie on your back with your knees bent and your feet flat on the floor. Slowly raise your pelvis until your body forms a straight line and then lower it back down. Repeat 10-15 times. Gluteus stretch. Sit on the floor and cross one leg over the other with the ankle next to the knee of the other leg. Twist the torso to the side of the crossed leg and press the knee of the other leg down slightly until you feel a stretch in the gluteus. Hold the stretch for 20-30 seconds and repeat on both sides. Balancing and stability exercises. One-legged stand. Stand on one leg and maintain balance for 30-60 seconds while stabilizing the core and keeping the knee slightly bent. Repeat on both sides. Stability cushion exercises. Stand or sit on a stability cushion and try to maintain balance while making small movements to improve knee stability. Functional movement exercises. Squats. Perform controlled squats to improve knee stability and strengthen the muscles around the joint. Stair climbing. Climb up and down stairs slowly and in a controlled manner to strengthen the muscles in the knee and improve mobility. Before starting a physical therapy program, it is important to seek advice from a doctor or physical therapist to ensure that the exercises are appropriate for your individual situation and will not cause further injury. It is also important to perform the exercises slowly and in a controlled manner and to stop immediately if you feel pain. Complementary treatment methods. Complementary treatment methods can be a useful addition to conventional medical treatment for meniscus pain. These methods can help reduce pain, reduce inflammation, and promote healing. Here are some commonly used complementary treatment methods. Acupuncture. Acupuncture is a traditional Chinese treatment method that involves placing fine needles at specific points on the body to relieve pain and regulate the flow of energy in the body. For meniscus pain, acupuncture can help reduce pain, reduce inflammation, and promote circulation. Massage therapy. Massages can help relax the muscles around the knee, improve circulation, and reduce pain. Special massage techniques can be used to improve knee mobility and relieve symptoms of meniscus pain. Physical therapy. Physical therapy can play an important role in treating meniscus pain by including exercises to strengthen the surrounding muscles, improve knee mobility, and promote healing. Physical therapists can develop customized treatment plans based on the patient's individual needs and abilities. Chiropractic. Chiropractic adjustments can help improve skeletal alignment and joint mobility, which can be beneficial for meniscus pain. A chiropractor can make specific adjustments to reduce stress on the knee and relieve symptoms. Hyaluronic acid injections. Hyaluronic acid is a substance that occurs naturally in the body and lubricates and cushions joints. Injections of hyaluronic acid can help improve joint function and relieve symptoms of meniscus pain by reducing friction in the joint and improving mobility. Dietary supplements. Certain supplements, such as glucosamine and chondroitin, may help support joint health and reduce the symptoms of meniscus pain. These nutrients may promote the formation and maintenance of cartilage tissue and improve joint function. It is important to note that complementary treatments should not be considered a replacement for conventional medical treatments, but rather a complement to them. Before trying any complementary treatment, you should seek advice from a healthcare professional to ensure that it is safe and appropriate for your individual situation. Rehabilitation after meniscus injuries. Rehabilitation after a meniscus injury is an important part of the recovery process to restore mobility to the knee, strengthen the surrounding muscles, and regain full function of the joint. Here is an overview of the rehabilitation steps after a meniscus injury. Early phase of rehabilitation. Rest and relaxation. In the first few days or weeks after the injury, it is important to rest the affected knee sufficiently and avoid strenuous activities to prevent further damage. Inflammation control. Applying ice and taking anti-inflammatory medications can help reduce swelling and inflammation in the knee and relieve pain. Mobility exercises. Gentle mobility exercises, such as passive and active movements of the knee, can help maintain the mobility of the joint and prevent adhesions in the tissue. Muscle activation. Start with light isometric exercises to activate the surrounding muscles and improve the stability of the knee without putting strain on the joint. Middle phase of rehabilitation. Strengthening exercises. Advanced exercises to strengthen the thigh muscles, especially the quadriceps and hamstrings, are important to improve knee stability and protect the joint. These include exercises such as squats, leg presses, and hamstring curls. Balance and coordination exercises. Exercises to improve balance and coordination, such as one-legged standing and exercises on a balance cushion, can help improve the proprioceptive abilities of the knee and prevent injuries. Functional training. Incorporate functional exercises that mimic everyday movements such as climbing stairs, running and jumping to improve knee mobility in real-life situations. Endurance exercise. Regular aerobic exercise, such as walking, cycling or swimming, can help improve endurance and increase overall fitness, which in turn aids recovery. Late phase of rehabilitation. Sport-specific training. Once the pain has subsided and the mobility and strength of the knee have been restored, sport-specific exercises and activities can be introduced to help the knee become accustomed to sporting activity again. Continuous monitoring and adjustment. Rehabilitation should be continuously monitored and the exercise program should be adjusted according to progress and needs. A physical therapist or sports medicine doctor can help evaluate rehabilitation progress and plan next steps. Return to sport. Return to sport should be gradual and done in consultation with a doctor or physiotherapist to ensure that the knee is completely stable and able to bear weight. Effective rehabilitation after a meniscus injury requires patience, commitment and consistent implementation of the rehabilitation program. It is important to follow the instructions and recommendations of your medical team to ensure a successful recovery and minimize the risk of subsequent injuries. Part 4. Practical knee exercises for at home. The fourth part of the book presents practical knee exercises to do at home that aim to improve the stability, mobility and strength of the knee, as well as strengthen the surrounding muscles. These exercises can help relieve meniscus and osteoarthritis pain, support joint function and reduce the risk of injury. Here are some possible exercises that could be included in this part of the book. Squats. Stand with your feet shoulder width apart and your toes turned slightly outward. Slowly bend your knees and lower your body as if you were sitting down until your thighs are parallel to the floor. Then push yourself up through your heels to return to the starting position. Repeat for 10-15 reps. Lunges. Stand upright and take a big step forward with one leg while keeping the other leg behind you. Bend both knees to lower yourself until the front knee forms a right angle. Then push yourself up with your front leg to return to the starting position. Repeat this alternately for both legs for 10-15 reps on each side. Leg raises. Lie on your back and bend your knees while keeping your feet flat on the floor. Slowly lift one leg off the floor until it is perpendicular to the floor. Then lower it again. Repeat for 10-15 reps on each leg. Hamstring curls. Lie on your stomach and stretch your legs. Bend one leg by pulling the heel toward your buttocks. Then slowly lower it again. Repeat for 10-15 reps on each leg. Calf raises. Stand with your feet on the floor and your hands on a wall or chair for support. Slowly lift your heels off the floor to rise onto your tiptoes. Then lower them back down. Repeat for 10-15 reps. Balancing exercises. Stand on one leg and hold your balance for 30-60 seconds. Try to bend the knee slightly and stabilize the core to maintain balance. Then switch to the other leg and repeat the exercise. These exercises can be adapted and modified according to individual fitness level and needs. It is important to perform the exercises slowly and in a controlled manner and to stop immediately if you feel any pain. If you have any concerns or need further guidance, consult a doctor or physical therapist before starting any exercise program. Important exercises to strengthen the knee muscles. Strengthening the knee muscles is crucial to improve knee stability, prevent injuries and reduce pain. Here are some important exercises to strengthen the knee muscles. Squats. Stand with your feet about shoulder width apart and your toes turned slightly outward. Bend your knees and slowly lower your body as if you were sitting down until your thighs are parallel to the floor. Then push yourself up through your heels to return to the starting position. Make sure to keep your knees over your toes and do not fall inward. Repeat for 10-15 reps. Lunges. Stand upright and take a big step forward with one leg while keeping the other leg behind you. Bend both knees and slowly lower your body until your front knee forms a right angle. Then push yourself up with your front leg to return to the starting position. Repeat this alternately for both legs for 10-15 reps on each side. Leg raises. Lie on your back and bend your knees while keeping your feet flat on the floor. Slowly lift one leg off the floor until it is perpendicular to the floor. Then lower it again. Focus on engaging your abdominal muscles and activating your glutes to increase stability. Repeat for 10-15 reps on each leg. Hamstring curls. Lie on your stomach and stretch your legs. Bend one leg by pulling the heel toward your buttocks. Then slowly lower it again. Focus on activating the muscles on the back of the thigh. Repeat for 10-15 reps on each leg. Calf raises. Stand with your feet on the floor and your hands on a wall or chair for support. Slowly lift your heels off the floor to rise onto your tiptoes. Then lower them back down. This exercise strengthens the calf muscles, which are also important for the stability of the knee. Repeat for 10-15 reps. These exercises aim to strengthen the major muscles around the knee, including the quadriceps, hamstrings, and calf muscles. Performing these exercises regularly can help improve knee stability, reduce pain, and prevent injury. Stretching exercises for more mobility in the knee. Stretching exercises can help improve mobility in the knee, increase flexibility of the surrounding muscles, and reduce tension in the joint. Here are some stretching exercises recommended for increased mobility in the knee area. Quadriceps stretch. Stand upright and grasp the ankle of your foot with one hand as you pull your knee back until you feel a stretch in the front of your thigh. Hold the stretch for 20-30 seconds and repeat on the other side. Be sure to pull the knee down to increase the stretch, but avoid excessive strain or pain. Hamstring stretch. Sit on the floor and extend one leg forward while keeping the other bent to place the foot on the inside of the extended leg. With your back straight, slowly bend forward over your outstretched leg until you feel a stretch in the back of your thigh. Hold the stretch for 20-30 seconds and repeat on the other side. Make sure to keep your back straight and keep the stretch gentle without pulling too hard. Calf muscle stretch. Stand with one foot about one step in front of the other and bend the front knee while keeping the back leg straight. Press the heel of your back leg firmly into the floor until you feel a stretch in your calf muscles. Hold the stretch for 20-30 seconds and repeat on the other side. Make sure to keep the back leg straight and keep the stretch gentle without pulling too hard. Inner thigh stretch. Sit on the floor and bring the soles of your feet together with your knees open to the sides. Grab your feet and gently press your knees down until you feel a stretch in your inner thigh muscles. Hold the stretch for 20-30 seconds and repeat if necessary. Be sure to keep the stretch gentle and not cause excessive strain or pain. IT band stretch. Stand upright and cross one leg in front of the other. Tilt your upper body toward the side of your back leg until you feel a stretch in the side of your thigh. Hold the stretch for 20-30 seconds and repeat on the other side. Be sure to keep the stretch gentle and not cause excessive strain or pain. Full body training to support knee health. A full body workout that supports knee health should include exercises that strengthen the surrounding muscles, improve knee stability and mobility, and reduce the risk of injury. Here is an example of a full body workout aimed at promoting knee health. Warm up. Start with 5-10 minutes of light cardio, such as walking, cycling or jogging, to warm up muscles and increase blood flow. Quadriceps strengthening. Squats. Perform 2-3 sets of 10-15 squats to strengthen the quadriceps muscles, which aid in knee stability. Hamstrings and gluteus maximus strengthening. Leg raises. Perform 2-3 sets of 10-15 leg raises per leg to strengthen the hamstrings and glutes, which aids in knee stability. Calf muscle strengthening. Calf raises. Perform 2-3 sets of 10-15 calf raises to strengthen the calf muscles, which aids in knee stability. Core strengthening. Planks. Hold a plank for 30-60 seconds to strengthen abdominal muscles and core stability, which supports posture and knee stability. Balance and stability exercises. One-legged balance. Stand on one leg and hold the balance for 30-60 seconds to improve balance and knee stability. Bosu ball exercises. Use a Bosu ball for exercises such as one-legged squats or balancing to improve balance and stability. Stretching. After your workout, stretch your key muscle groups, including your quadriceps, hamstrings, glutes, and calf muscles, to maintain flexibility and reduce muscle soreness. Cooling. Finish the workout with 5-10 minutes of light cardio and some stretching exercises to relax the muscles and slowly lower the heart rate. It is important to do this exercise regularly, at least 2-3 times a week, to support long-term knee health. Be sure to perform the exercises slowly and with control and stop immediately if you feel pain. If you have any concerns or need further guidance, consult a doctor or physiotherapist. Part 5. Lifestyle changes for long-term results. The fifth part of the book introduces lifestyle changes that support long-term knee health outcomes. These changes are designed to help improve overall health, control body weight, reduce stress on joints, and reduce the risk of knee injury. Here are some key lifestyle changes that could be covered in this part of the book. Weight management. A healthy diet and regular physical activity are crucial for controlling body weight. Being overweight puts strain on the knee joints and increases the risk of knee pain, osteoarthritis and other knee problems. Healthy eating. A balanced diet with plenty of fruits, vegetables, whole grains, lean proteins and healthy fats can help reduce inflammation in the body and support joint health. Foods rich in omega-3 fatty acids, antioxidants and vitamins may be particularly beneficial for knee health. Regular exercise. Regular physical activity, including both aerobic exercise, for example, walking, swimming, cycling, and strengthening exercise, for example, weight training, Pilates, yoga, can help strengthen the muscles around the knee and improve joint function. Avoid excessive strain. Excessive stress on the knees from high-intensity or repetitive activities can lead to injury and compromise knee health. It is important to pay attention to your body's warning signals and avoid overloading by increasing your training slowly and allowing sufficient rest breaks. Ergonomics and posture. Good posture and ergonomic working conditions can help reduce the strain on the knee joints in everyday life and minimize the risk of injury. Make sure to maintain an upright posture when sitting, standing and lifting, and do not place excessive strain on your knees. Stress management. Chronic stress can increase inflammation in the body and affect knee health. Stress management techniques such as meditation, yoga, breathing exercises and relaxation techniques can help reduce stress and support knee health. Regular medical examinations. Regular medical examinations can help detect and treat knee problems early to prevent long-term damage. By implementing these lifestyle changes, long-term results for knee health can be achieved. It is important to introduce the changes gradually and focus on making a permanent lifestyle change. If you have any concerns or questions, you should always consult a doctor or professional. Ergonomic tips for everyday life. Ergonomic tips for everyday life can help reduce stress on joints, improve posture and minimize the risk of knee injuries. Here are some ergonomic tips that can be applied in everyday life. Workplace design. Make sure your workstation is ergonomically designed, with a sturdy chair that provides good back support and is the right height for your desk. To avoid strain, position your keyboard and mouse so that your wrists are straight and your forearms are parallel to the floor. Use a footrest to relieve pressure on your legs and promote an ergonomic sitting position. Posture when sitting. When sitting, make sure to maintain an upright posture with your feet flat on the floor and your knees at approximately a right angle. Use lower back support to maintain the natural curvature of the spine and avoid back pain. Lifting and carrying objects. Bend your knees and squat to pick up heavy objects from the floor rather than lifting them from your waist. Keep heavy loads close to your body to reduce stress on your joints and avoid twisting or bending while carrying heavy objects. Active breaks. Take regular short breaks to stand up, stretch and walk a few steps to promote blood circulation and relieve muscle tension. During work breaks, perform simple stretching exercises for the whole body to maintain mobility and reduce tension. Sleeping position. Make sure your sleeping position supports the natural alignment of the spine by using a mattress and pillows that provide adequate support and keep the head, neck and back in a neutral position. Footwear. Wear shoes with good cushioning and support, especially if you have to stand or walk for long periods of time, to reduce stress on the knee joints and improve stability. By implementing these ergonomic tips in everyday life, strain on the knee joints can be reduced and the risk of injury minimized. It is important to check posture regularly and make adjustments to promote an ergonomic work environment and support long-term joint health. Stress management and relaxation techniques. Stress management and relaxation techniques can help reduce stress, reduce physical tension and support knee health. Here are some effective techniques that can be used in everyday life. Deep breathing and breathing exercises. Take a few minutes to breathe deeply and slowly, inhaling deeply into your belly and then exhaling slowly. Breathing exercises such as the 4, 7, 8 method. Inhale for 4 seconds. Hold for 7 seconds. Exhale for 8 seconds can help calm the body and reduce stress. Progressive muscle relaxation. Tense different muscle groups one after the other and then consciously relax them to reduce physical tension. For example, start with your toes and slowly work your way up to your shoulders and face. Meditation and mindfulness. Practice meditation or mindfulness exercises regularly to calm the mind and be in the present moment. Sit quietly and focus on your breathing or repeat a calming mantra to quiet the mind. Yoga. Yoga exercises can help promote both physical and mental relaxation. Practice gentle yoga poses that improve posture, increase flexibility and release tension in the muscles. Progressive muscle relaxation according to Jacobson. This method involves deliberately tensing and then relaxing the muscles to achieve deep relaxation. Through conscious awareness of muscle tension and relaxation, the body can react to stress and relax. Hobbies and interests. Take time for activities that bring you joy and relax you, such as reading, painting, gardening or listening to music. By focusing on positive activities, you can reduce stress and improve your mental health. Social support. Talk to friends, family, or a therapist about your feelings and stresses to get emotional support and perspective. Sharing thoughts and feelings can help reduce stress and increase resilience. Long-term strategies for healthy knee health. Long-term strategies for healthy knee health include a combination of preventative measures, regular exercise, a balanced diet, weight management and mindful lifestyle choices. Here are some long-term strategies. Regular exercise and training. A regular exercise program that includes both aerobic exercise and strengthening exercises can help strengthen the muscles around the knee, improve mobility, and increase stability. This reduces the risk of injury and supports overall knee health. Weight management. Being overweight puts strain on the knee joints and increases the risk of knee problems such as osteoarthritis and injuries. Maintaining a healthy body weight through a balanced diet and regular exercise is therefore crucial for long-term knee health. Strengthening the muscles around the knee. Targeted training of the quadriceps, hamstrings, calf muscles and the muscles around the knee joint can help improve the stability and support of the knee and reduce the risk of injury. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, lean protein and healthy fats can help reduce inflammation in the body and support overall joint health. Avoid overload. Excessive stress on the knees from high-intensity or repetitive activities can lead to overuse injuries. It is important to pay attention to your body's warning signals and avoid overload by increasing your training slowly and allowing for adequate rest breaks. Ergonomic practices. Adapting the workstation and using ergonomic aids can help reduce everyday strain on the knees and improve posture. Regular medical examinations. Regular medical examinations can help detect and treat knee problems early before they become serious problems. Lifestyle changes. Adopting a healthy lifestyle that includes regular exercise, a balanced diet, stress management and adequate sleep can help support long-term knee health. Rights and ownership notice. This audiobook is published and distributed by Veröffentlichung LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Veröffentlichung LLC. Veröffentlichung LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Veröffentlichung LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership. The 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Veröffentlichung LLC. All rights reserved.